hizo wanaona unaenda bure, una pesa, unapara ziko.
Kwambia toka kabisa na wanafunga mlango kabisa mpaka unaona yani.
Wakikuona umevaa vizuri ndio wanakushughulikia, na ukiona kama umevaa tu hivi hawakushughulikia.
I'm not the one who pregnated you. That's kind of the words from the nurse.
Ule msichana alikuwa anaenda pale kupata mtoto. Ikawa manasi sasa wako tayari. Sasa ikawa mpaka wale watu wa kufanya attachment pale washughulikie yule mama. Baadaye walimshughulikia vibaya akakufa.
This is the healing process. Nurse-patient relationship is an integral part in the healing process. This process is wholesome and requires the participation of all the parties involved, the nurses and their patients. In particular, this process depends much on the understanding of one another, their relationship and their interaction.
Nurse-patient relationship is a common understanding between the healthcare provider, a nurse in this case, and the patient.
When you meet a patient, you don't know this person, but you must establish a relationship in order to be able to nurse the patient, or rather give medical advice to this patient.
When you deal with the patient, you don't only deal with the patient, because when the patient is sick, you will also communicate with the relatives.
Patient-doctor relationship is a two-way. There's the doctor who also needs to explain to the patients as to why they need to do what they are explaining to them, because in other words, they are the ones who are trained professionally, they are the ones who understand what the patient may be going through. But on the other hand, the patient also has to accept, and the patient has to own and take responsibility over the challenge that they may be going through or the situation that they are in.
A reality check on the ground reveals that this relationship has not been up to the expected professional standards. Instead, it has been below the par required from any service that touches on the life of not only an individual, but also the nation as a whole. It has been an ailing relationship.
Is kind of poor because, as we all know, I think nursing is a profession that is a calling rather than just one of those that you walk into and decide to study and go for a job.
Wanaona unaenda bure, una pesa, unapara ziko.
Kana niongeze kama wamekasirika, saa zingine kwambia toka kabisa na wanafunga mlango kabisa mpaka unaona yani kwani mtoto wangu anakaa aje mwenye, saa zingine wanafunga mlango kabisa wanakuambia toka uende.
I happened to hear kind of a quarrel. It was between a nurse and a patient who was in pain and trying to give she was to give birth. Then in the process, because of the pain, she could not do some of the instruction that nurse was trying. Then it was kind of an exchange of words, quarrel. There was a kind of abuse. I'm not the one who pregnated you. That's kind of the words from the nurse. The day you are doing it, you are enjoying it.
You go to health cares and dispensaries where nurses are in charge. You go there and you try to explain to them what you're suffering from. Before even you finish, they have already written to you what you need to take and everything. Even they don't explain to you, as in they don't have that time to explain to you what the disease is about and everything.
This relationship has been linked to that of master to servant model. The patients regard their health attendants as superior to them. Similarly, health experts regard patients as inferior to them. There is complete misunderstanding and total confusion even among the nurses themselves on how the relationship should be.
My relationship with the patient should be therapeutic, should be a relationship that helps the patient get over what they're suffering from. Because I'm supposed to know the patient inside the hospital.
Equal a friendly relationship, because I'm staying with you most of the time. So if I don't accept you, if I don't treat you well, I mean, you'll give me a difficult time, I'll give you a difficult time.
The relationship should be ideal, whereby there is a common understanding between a nurse and a patient, so that the service delivery will not be compromised.
So it's important to have a relationship. You answer all the questions that the patient would want to ask, and then you tell them, you sell the benefits as to why those drugs are important and why they need to adhere or to stick to the regimen that they have been prescribed.
Communication. Let's say if it's a mother, when a child is very sick, they get so irritable. So you really have to know how you're going to communicate with these people so that you can soothe them and so that they can trust you either with their kids and with their patient.
Several challenges that face this interaction have been cited. They emanate from either of the sides, the nurses and the patients. Most of them are as a result of poor communication methods and lack of effective communication skills.
In other situations, I think they are really overworked. There are few, patients are more.
Kama kuna wakati ulikuwa wakati wa mgomo, ndio kesho yake waende mgomo, walikuwa wanasema hatujalipwa vizuri ndio sababu hatuwezi kuwatibu. Kwa mpaka tulipwe kesho ndio tunaenda ku strike, ndio tukilipwa vizuri ndio tutakuja sasa tutakuwa tunawahudumia vizuri, lakini sijaona tofauti.
Most of the nurses that we have in our hospitals are not really motivated by a self-drive. They are motivated to just earn a living.
Hawana ile roho ya upendo na ndani yao, yani ile roho ya huruma ndani yao.
Attitude, bad attitude. We think that nurses or other caregivers are not important people. Nowadays we think of those big careers as the best. So you think that nursing is really not up to standard. It's a noble job anyway.
Some of them come to the hospital, already they have Googled what they're suffering from. The doctors told them you're suffering from ABCD. They've already gone through it. So maybe some of them will just be brainstorming, do you know about this and this?
Other times they expect so much from the nurses. For example, even to extent of thinking they will be able to provide, the nurses will be able to provide maybe some food for them and that kind of stuff.
They will assume that the health workers have a negative attitude. Because again, when the patients come to the health facility, sometimes every person has their own perceptions of how they would want to be treated. So sometimes if the health workers are not going to meet the needs or the demands of the people's perception, then sometimes they will accuse them of having a negative attitude. And of course, again, we still know that some people really, they also have a negative attitude depending on the conditions that they see.
And the blame game continues day after day. The healing process stalls. It is carried out under fear and tension and in gloomy atmosphere in most of the public hospitals. Other more impediments are cited as determining factors that hinder nurse-patient interaction.
Unakuta zile ndawa zikiletwa pale wao uchukua, wanaenda kuziuza pale zingine. Unakuta wewe ni daktari, uko na chemist. So inamaanisha pale wewe utafanya kazi kwa muda tu, mradi uonekane pale. Alafu baadaye wakimbia kwa biashara zako. Wengi wanaweka hizi biashara kama za magari, matatu, hizi mavilabu, kuuza mabaa. Sasa hakuna vile atapika nyungu tatu. Na nyungu ni moja, tunataka upike ive mzuri.
You have paid, but they will tell you, go buy the drugs in the chemistry. But the fact is that you have paid the money you expected to be treated and be given the medication.
Wakikuona umevaa vizuri ndio wanakushughulikia, na ukiona kama umevaa tu hivi wakushughulikia sababu wajue ni nani, kama wewe ni askari ama ni mkubwa wa madaktari wao, ndio sababu wanakuhudumia haraka.
Someone can be put across to be put first before others just because of his social status in the society, and yet there are more people with needs and more people that were sick and that needed more attention than this guy who came in and just walked past us.
Ukabila iwezi kosa, mishandling iwezi kosa, kudhulumu watu iwezi kosa, iko.
If you are the nurses tribe, if you talk, the nurse will help you and you'll get treated. But if you are not, you will wait there until you get frustrated.
These and much more affect the delivery of medical services and shape the socio-climatic condition in which the services are offered. There is great need for each of the parties involved to identify some of these impediments and provide a correct and timely solution for the advancement of the healing process.
Kitu ya kwanza, ukosefu ya staff ya kutosha. Ya pili, mishahara au mazingira mbaya.
The nurses get from their homes. when they're really frustrated, maybe with the family matters, and then they bring them to the hospital where you cannot even approach a nurse. You're approaching a nurse, but the nurse is walking away.
Nurses are human beings, and when nurses carry their attitude or their problems at home that you are not able to manage at home and transfer that to patients, then you find that there is that kind of lack of common understanding between a nurse and patient. And even in terms of service delivery, you find that a nurse who is not quite who is not concentrating would be able to do a few mistakes here and there on the patient.
Generally, just the way people are. Some people are kind, some people are not kind to patients. Maybe that patient in that state. Generally, yes, you're supposed to be kind to the patient. You're supposed to be humble. You're supposed to take care of these patients as though it was us on that bed at that time. So if a staff also has a bad attitude, you see, it's human. It's human nature. You're dealing with very many people. Yes, they are professionals, but sometimes you get those ones who maybe talk to the patient in a harsh tone, and see the patient will say, that one, even if she comes, I won't say anything. Maybe she'll scold me, she'll tell me this.
But it also depends with the patients, because there are some patients that may not be in a position to follow the policy in place of the institute.
Once you get unwell, you remove the coat of your professionalism and you treat yourself as another human being, just like any other human being. And if you are sick, you just go and look for a professional in that area so that you can be attended to, and just be open, and no matter how intellectual you are, you leave to that person who is there at that particular moment.
These hindrances have adverse negative effects on the delivery of the medical services and the healing process as a whole. Some of these effects are fatal, while others have long-term effects on the people involved.
Hivi karibuni nimekuwa na rafiki yangu ambaye ule msichana alikuwa anaenda pale kupata mtoto. Ikawa manasi sasa wako tayari. Sasa ikawa mpaka wale watu wa kufanya attachment pale washughulikie yule mama. Baadaye walimshughulikia vibaya, akakufa. Mama naye akachukuliwa hatua ya dharura, akakimbizwa hospitali nyingine. Baadaye pia akakufa, ikawa amekatakatwa sehemu mbaya mbaya.
A family friend of ours, her leg was rotting. So when we took her to Kenyatta Hospital, she was derailed, and she was in so much pain, and we tried to tell the nurses that, she's in pain and they need to attend to her before anything could happen. And it was so sad because when her time reached, it was too late because her leg later on was amputated.
Kuna mwingine alikuwa na mimba na mtoto mwingine kwa mkongo, na mwingine amepepa. Sasa mwenye alikuwa amepepa ndio mkubwa na ni mkonjwa. Na kuna mimba pia na kuna mtoto mwingine kwa mkongo. Sasa akafika mtibu na alifika late. Alimwambia arudi wakafunga mlango bila kutibiwa.
Bad patient-nurse relationship would mean that what you're telling this patient, they are not ready to do. That the effect on that would be that they will not recover as they should. For example, if they refuse to take their medication on time, that will affect the way they heal. If they refuse, for example, after surgery, they refuse to walk or maybe just follow the instructions you're giving them, that will hinder. Some, because of social status, they think that a nurse is not really a caregiver, but they view like you're somebody who is lesser than them, and whatever you tell them to do, their pride does not allow them to follow what you're saying, and sometimes that would hinder their recovery. Dealing with a patient who is difficult is not really satisfying to the nurse. So you find that if this nurse had more information to give to this patient, there's that blockage. So it will mean that even if I knew so much to tell this patient, but this patient is not ready to reciprocate or receive from me what I'm telling him or her, then I'd rather just stay with my knowledge.
The importance of effective communication and social relationship on the health of an individual cannot be underrated. Effective and proper nurse-to-patient relationship have several effects for the patients, their relatives, the nurses, and the hospital as a whole.
Mother had lost 7 pregnancies. She didn't have the caregivers. She knew that was out out of their reach. They had done their best, and she kept on coming. But this one time she came, she had twins. She had to stay on bed rest for 9 months, actually from the first day to the last. And she went home with 2 beautiful babies, a boy and a girl. And that is really satisfying. You see, to her family has improved. Her people have faith in her now. Her husband is happy, my wife has children. Whatever strains there were because they didn't have children will now be not really forgotten because it took them a long time, but you see, there'll be happiness in that home.
First, it will allay anxiety, because when you're sick, you're anxious. What am I suffering from? Whom can I trust? Whom can I tell? When I tell these nurses, will they disclose my problems?
Satisfaction that you get from attending to these people who are helpless when they come to you and seeing them walk out of that door and they're fine and they're ready to go back to their daily activities is really what is unique about my profession.
This creates room for effective communication. It stands out as the truth that the healing process goes hand in hand with and is centered in communication.
The nurses, they were really rude, and they talked to us in a very, it wasn't nice at all. It was a very pathetic manner. If anything, I think they should also up their standards and the way they talk to people, because you don't expect to talk to a sick person in a very rude manner and expect the patient to feel comfortable with you as their nurse.
Nurses have to take some communication courses so that they can build that good rapport between the nurse and the patient.
Knowledge, attitude, communication skills, very important. And then the lastly and the major, professionalism.
Be open to the medics. Tell them all your problems. That will be able to help. And in case you're not satisfied with a certain answer or you didn't get any information, human is to error. Sometimes I can forget. Kindly just call back and say, there's this thing which you're to answer me. Don't shy, don't get annoyed and say, I usually ask and I'm not told. Continue asking, ask to be given updates about your condition, and that will create a good relationship.
Attitude breeds attitude. If your attitude is positive towards me, I'll give you my best and I'll even go an extra mile. But if your attitude is negative towards me, the caregiver, then there's going to be a block as much as I want to give all my best to you.
As time goes by, there is urgent and great need for action to strengthen the ailing nurse-to-patient relationship in public hospitals in order to change the perception of the parties involved and will ensure harmony, peace, love, unity and respect, and to encourage positive relationships within institutions. Quicker solutions are needed to address the situation from all the involved parties in the government.
Kitu ya kwanza, waongeze mshahara.
There should be provision of adequate supplies, equipment by the government. There should be the ideal nurse-patient ratio as opposed to one nurse serving 20 patients.
Sometimes work can be heavy for someone. You might be so overworked, but the nurses should try and be considerate as to whom or where or what persons need more help than the other, because if I walk in with a cold and someone else walks in, has been knocked by a vehicle, can barely breathe, just because I can pay money before this person and I can get attended to before this person, it should change. It should be a culture that people are out there to help one another and not to see who can benefit them. Let it not be a society for scratch my back, I scratch your back.
Either if the patient is not able to understand you, the thing that we need to do, especially the nurses, just give her or him time. Don't be too much high, just give her own time. Because when somebody is in pain, is not able to understand some certain things, just give her time.
Jiulize tu hao pia ni wanadamu tu kama sisi. Ndio hata pia wanaweza gonjeka kama wanaweza enda hospitali nyingine. Hata kama daktari pia anafuatiliwe.
It is therefore no doubt that if these measures are taken, there would be effective nurse-to-patient relationship that will advance and foster timely and standard healing process.